Hi, my name is Arissa Kyler, and I am one of the pelvic PTs at Limitless at our Victor location. And I've made this workshop about what no one tells you about postpartum and how to normalize those things and thrive in the newborn months. This specifically has come out of me being postpartum myself. My baby is now almost 5 months old. And even as a pelvic PT, there was so much that I did not expect. And sometimes it could feel really isolating, so I wanted to create some normalization around this and talk about it so that you can feel like you can thrive during those hard months. All right, so a little outline here. Um, we're going to talk a little bit about birth, hormone changes that happen, that shift, sleep, identity shift as well, healing, exercise, diastasis recti. There's a lot of misinformation out there about that, breastfeeding, and then some miscellaneous kinds of things and how to help baby cope at doctor's appointments. So, a little bit about me. I also, in addition to being a pelvic PT, I help run our pelvic residency program at Limitless so that we get more people doing pelvic health. I'm also a yoga teacher, and my daughter was born this past December in 2024. Her name is Hazel. And then just some of my interests, I love just, spending time with my baby, of course, and my husband and dog, strength training, yoga, running, music, those kinds of things. A little bit of a disclaimer here. Um, so my expertise is in the rehab and the preparation surrounding birth and pregnancy postpartum. So we'll talk about some things of like sleep and whatnot, but note that I'm not an expert in those areas. So some of these things are just personal experience too. So, goals of this presentation are to normalize knowing what to expect, avoid feeling isolated. Just putting words to some of these things can be really helpful, saying the scary things out loud. Providing more support. So, being able to lean into the community. So, our community at Limitless here of lots of parents, but also in your own community, family, and friends. And then to shift into empowerment, right? So, this is kind of that sliding scale that we normalize first, we get our support, and then we feel empowered going through this journey. This is my daughter. Her name is Hazel Gray. She was borderline small for gestational age at 6 pounds. I was induced. So, this whole birth plan that I had come up with really didn't happen. And so that was difficult for me to process through. And that shift was very difficult. So, it's given me a lot of empathy for the people I work with. So, some surprises from birth preparation. We talk about perineal massage and stretch as a way to decrease tearing, but the research only shows that it's effective 50% of the time in decreasing the risk of tearing, which can be very, very natural. However, what I think it's more beneficial for is that sensation of stretch in the perineum, but also 360 degrees around that vaginal opening because baby's going to come through there and stretch that whole area. So getting used to that sensation of the stretch I think is more beneficial for the perineal massage versus decreasing the risk of tearing. Um, Also, I think I would have spent more time practicing bearing down with holding my breath. So you can choose to exhale and push when that pushing time comes in active labor, or you can hold your breath and push. If you hold your breath and push, you produce more force, but it's more pressure on the pelvic floor. If you exhale while you push, it's less pressure on the pelvic floor, but you have decreased force of your push. So you can use a mixture of both or whatever is needed. I needed to use the breath hold during my birth, which I was actually surprised about. And we focus so much on not bearing down in our life in general, unless you're giving birth or starting a bowel movement and you're gently bearing down at that point. That this was actually really, really hard for me. So I would have spent a little bit more time practicing this. And then a lot of strength and endurance. So I trained throughout my pregnancy, strength, endurance, yoga, a good mix. But with the induction, I was really exhausted and wasn't able to do the things I thought I would be able to do because of that. So just increasing strength and endurance as much as possible during pregnancy is really helpful for labor. Another surprise is that it was quiet in the labor room. So with my husband there, and you can see in this picture, I have like a diffuser going and there was some music in the background, but there's a lot of downtime and quiet, which I wasn't expecting. So it's just something to be aware of and what kind of person you are and what you like to have. So you can plan ahead for that. You can request wireless monitors. However, note that they have like almost like little Velcro. It's not Velcro, but it's kind of like looped little plastic. Um, it's really itchy though. So just it's one more sensation that you'll have if you choose that wireless monitor. But a lot of hospitals have like a limited supply and you can request those. Um, Another surprise is that your body just kind of clears out. So there might be a point where you might throw up, where you might have a bowel movement because your body just kind of knows that you got to have this baby and it's starting to clear those other functions out. So it's something just to not be scared of. Fueling is so important during pregnancy. So having like protein balls or like the squeezable nut butter packets or like applesauce packets, things that are easy to consume um, is really important throughout your labor. Most OBs will let you eat now during labor. There used to be, some concern over um, increasing the risk of vomiting and whatnot. But unless there's like another reason or like a special circumstance, a lot of OBs will let you eat during prep or during your labor now. Electrolytes can be really helpful to keep you hydrated and strong. The Earth Mama products are also something I wanted to share because those are really helpful postpartum. They have like a whole kit that you can get that has like nipple cream, perineal balm, perineal spray, ice packs for the breast if breastfeeding. So those have been a lifesaver postpartum. And then also last thing, this is kind of um, different subjects here, but if you're going home and you're nervous about your dog meeting your baby, there is a dog meets baby course. That's what it's called. We took that and it was really helpful in teaching our dogs like certain commands and what to expect, and then how to navigate that interaction with the baby and as she grows. So, some postpartum changes here. There are drastic hormone changes. Um, there's a whole identity shift. There's the lack of sleep on top of that. And then all this healing that's happening. So, we think of like these super moms doing it all, but keep in mind that your body is doing all of these things at once. There are lots of layers, and to give yourself some grace with this. And just remember this as you're going through it. So, a little bit about that drastic hormone change. So, in pregnancy, we're at a high estrogen and progesterone levels. And then postpartum, these levels tank. So, now you're in a low estrogen and progesterone state. This can lead to mood swings, fatigue. It can lead to hair thinning too. My OB, after giving birth, told me that it's normal to cry every day for the first 2 weeks, but it's not normal to cry all the time during that. And so that could be an indication if you're experiencing some postpartum depression, if it's exceeding, a small portion of the day you're crying for those first 2 weeks. And she was absolutely right. So I was surprised by that. And I was so glad that she told me that. So I knew, what was normal and what was not normal. Also, what happens are oxytocin and prolactin increase if you're breastfeeding, and this will make the uterus contract to return to its normal size. So you'll feel that when you're breastfeeding. And then also, the oxytocin promotes bonding as well. So, all these things that we've talked about and on the previous slide, how do we bond with all of this? There's a lot that our bodies are going through. You've just done the hardest thing in your life, giving birth, and then you feel like you need to rest, but you can't. All of a sudden, now you're dealing with the hormone shift, a new baby, and the decreased sleep, all of that. So it can be really normal to feel isolated, to feel guilty, to have those mood swings and fatigue. You might even have anger, even at your baby, and that can be normal. Obviously, there are like safe practices. If you feel that increasing, you want to put baby in the crib and walk away, or give to a caregiver. Take some breaths, find your center again. But these can be really normal emotions, and they will pass, and you will be able to bond with your baby. But it can be really difficult initially. And I had a really hard time with this too, because I'm used to being up and moving around. And then all of a sudden I was on the couch breastfeeding pretty much an hour on, an hour off, because it was taking her a long time initially. So it's a huge shift. So in terms of sleep, newborns are really noisy when they sleep. I did not expect this. So even when they're sleeping, you might have difficulty sleeping there, right next to them. So that's something to be aware of. They have that day night confusion, which is because when you're pregnant and you're walking around throughout the day, you're rocking them to sleep. And then at night, you, people will often notice that baby's more active when you're trying to sleep and you're still, then baby's up and moving. So that continues for a while. And their circadian rhythm doesn't really develop until 6 weeks, and then it's continuing to develop. So that kind of day night mix up is really common and adds to that decreased sleep. So I put a strike through sleep when they sleep because I don't feel like this advice was helpful. Um, a lot of times these babies, they just love to contact nap. They're used to being in you when you're pregnant and feeling your heartbeat, your breath, hearing the whooshing sound that's similar to shushing of your blood flow. So contact naps are totally normal. You know, you see, to put them down drowsy but awake, and you can do that later on. But really, for those like first, honestly, 6 to 12 weeks, and even afterward, contact naps are totally okay. They need that. They're already compromising a lot by being outside of your body and maybe even taking like one nap on their own. So contact naps are okay. Don't stress about it. Remember, I'm not a sleep expert, but um, these are just some of those things that are normal for babies and wanting to be close to you and developing that secure attachment. EASY is an acronym, the Eat, Awake, Sleep, You Time. Again, this can be really true later on, but it might not be true early on because they might be contact napping on you, um, and that will develop later. Audiobooks I found were really helpful overnight, trying to stay awake or be engaged when I was feeding overnight. We really want to minimize blue light from our phones. That decreases melatonin production. So it'll keep you awake and baby awake. So in order to reduce that, listening to audiobooks. And then you might even like a little bit look forward to being up at night so you can listen to your audiobook. Ask for that partner help, in whatever way works for you. So reach out to your friends, see what they've done. But like for me and my husband, what we found works is that, I take care of the nighttime because I'm breastfeeding. Otherwise, I'd have to get up and pump if I miss a feed, and that can reduce milk supply, and we don't want that to happen. So I take care of the night, and then in the morning, on those days that we're able to do it. So, like on a weekend, or if your partner has parental leave, they can take the baby early in the morning, and then you can take like a 2 to 3 hour nap in the morning before you get up. So, that's what we found works for us, might not work for everyone. Another thing that helps, especially like with a winter baby, not a summer baby, but a winter baby, is putting a heating pad like on, medium. You don't want it super hot. Putting that in the bassinet, removing it before you put baby down, and put baby down on their tush first, and then roll them down on their back. That can be helpful to help them still feel cozy when they come away from the warmth of your body. All right, so a little bit about this identity shift. Your entire routine is different, right? It's like you're meeting a whole new person, which is you. I wrote time means nothing because days and nights just run into each other. Your body is different, and now it's made to sustain life. So there can be some pressure that you might feel related to that. It can feel impossible to get things done, like simple things, even just like a little bit of dishes or picking up. So it might feel more chaotic around you because it might be more cluttered and whatnot. Um, Also, you're constantly learning, which that in itself is exhausting. You might be Googling a lot. There's misinformation out there, conflicting information. One thing to be aware of is social media. You know, go to Instagram only if it serves you, though. We have more and more research showing that social media is not great for our mental health. And postpartum, we can see a lot of these moms who just seem to have it all together. And then we wonder why it's not working for our baby. So there can be some helpful information out there, but there is also a lot of not helpful information and even information from people who are not, who really shouldn't be sharing this. They don't have like the certifications or the education behind it. So just use some discernment if you're on Instagram with that. And also, our bodies are different. Our bodies feel different, they look different. So there's a lot that goes into this, and it can really affect us. We're doing a lot of healing. Feel like you need to rest after giving birth, but you're not able to. Your pelvic floor muscles, if giving birth vaginally, stretch 300%. So those muscles have gone through a lot and need to do a lot of healing. There can be pain, tearing, incision healing. Prolapse is actually very common early postpartum, so that feeling of heaviness. So that is normal to feel early on, but then if it persists, after like say 6 to 8 weeks or so, then definitely come see a PT and we'll work through that. You can also have bleeding and incontinence. Both of those things, if they increase, so if you have increased vaginal bleeding or incontinence with activities, you might be doing a little too much early on, and that's a sign to modify. You can have painful nipples if you're breastfeeding and say baby's mouth is small and you're both learning how to have baby latch. That might be happening early on, and that can make it difficult to breastfeed too. And then emotionally, depending on what happened with your birth story, you are processing all of that emotionally. So you might have also feelings of grief for no longer being pregnant. You might be feeling a pressure to bond if you haven't already. It can be normal not to bond right away. If you had a C-section, you would want to start some scar mobilization once healed. And that's something that we can work through at PT as well. And then there's this idea of being cleared at 6 weeks. So that is just to say that you're healing well at 6 weeks. However, it's often misconstrued to think, oh, I should be able to do everything at 6 weeks. And then people get really upset when they realize, oh, I'm having incontinence or I'm trying intercourse and it's really painful. This is actually very normal for intercourse to be painful at 6 weeks. Your body is healing up to a year postpartum. So at 6 weeks, this is super early on. So we can work through this, but we need to normalize that this is okay and we can work through it and there are things that we can do. And then if you are breastfeeding, you have that hormone shift, you're going to be drier vaginally. So loss of lubrication can help with that, as well as some other interventions if needed. So things to be aware of. This is a video here of me with my daughter when she was 6 weeks. PT with Jill postpartum, and she was refusing to nap in her stroller. She was really fussy, so I just put her in the carrier on me, and she just napped for the whole session. So this can be helpful for exercising. Just like little bouts of like think of like exercise snacks postpartum can be really helpful. So that's what we had to do for some of our sessions. In terms of during pregnancy, it is safe and recommended to continue exercising up to birth. There is decreased gestational diabetes and hypertension risk, and it improves if you already have those things. Exercise improves the management of those, obviously, like supervised by a PT, for example. It also improves your labor and delivery and postpartum outcomes because it takes so much fitness during labor and then recovering afterward. So the stronger you are going into your birth, stronger you are coming out of it and recovering. You can begin breathing and core bracing early after birth to your comfort level, and then begin progressing exercises as tolerated beginning at 2 weeks. So if there's any increased vaginal bleeding, heaviness, or incontinence, then we're going to modify early on. This Baby Bjorn Mini is the carrier that I'm wearing here. It's more meant for newborns, really easy to put them into. So just a little tip there for exercise. Let's talk a little bit about diastasis recti. Definitely do not Google this. There is a lot of misinformation out there that is not evidence-based. The truth is that this is normal in every pregnancy. So what this is the connective tissue between those six-pack abs. It stretches to make room for baby in your belly growing. This is completely normal. It is not tearing. It is not a separation at all. It's actually safe and recommended to do abdominal and core work with a proper core brace and managing pressure in your abdomen during pregnancy. So, when we're doing core work during pregnancy, we want to minimize what's called coning. This is where you would see a defined ridge in your abdomen over that center area. And you can see in this picture here, the center area, this is some diastasis postpartum. So if you saw coning during pregnancy, you would see this defined ridge over and across it. That is an indication of a pressure leak. And we want to manage that pressure better by adjusting our breathing or how we're bracing our core. Again, this can be helped at PT. It's sometimes difficult to monitor on your own. And then keep in mind that we heal at different rates and extents postpartum. So your body might not completely look like what it did prior to pregnancy, but we can really improve the strength and oftentimes can improve this drastically. Some of it comes down to your chemical makeup, though, of your connective tissue and skin as well. All right, a little bit on breastfeeding here. It can be really helpful to have a lactation consult in the hospital. I had a couple. They're there to do that. I think learning how to breastfeed sideline before you leave is really beneficial because then if you have healing vaginally or even C-section, you can be on your side and resting while you're feeding baby. Okay. Lactation medicine outpatient, if you're in the Rochester area, this is around Lattimore. They're really helpful too. I went and saw them a couple times and my insurance covered it anyway. Rochester Regional has these Zoom baby cafes that are free. So you can sign up for text alerts and they have them at different times where you can just hop on and ask questions. I also did that. I had a lot of anxiety surrounding breastfeeding and a lot of questions as I went along. A Rochester local podcast is the Badass Breastfeeding Podcast. This was really helpful to learn from. And then, when you have questions about going back to work, you can use all of these resources to help you with that. If you're having any nipple tenderness or cracking, saltwater soaks can be really helpful. So filling up little medicine cups with salt water and then just soaking the nipples for 30 seconds as needed can be really, really helpful. I learned this from lactation medicine. So that was really helpful in the healing because I had some difficulty early on. If you are going back to work and you're wondering, how to increase your stash at home and have enough for baby if you're exclusively breastfeeding, you can get a second letdown in the morning. So starting around 6 weeks, you can breastfeed and then pump afterward and slowly build up, a supply there. You don't want to do it before you feed baby because you want them to have and be able to take what they need. And then keep in mind, you need a lot of water and a lot of calories if you're breastfeeding. You need 500 more calories per day, which is even more than when you're pregnant, and about 80 to 128 ounces of water. So it can be hard to fuel postpartum, especially if you don't have partner help. So putting baskets of protein bars and snacks and water bottles in every room so they're easily accessible can be really helpful. Let's talk about some tummy time. So, tummy time is really important for babies to develop head control and the muscles they need for sitting up and walking and rolling over, all the things. So, you can begin this early on as you arrive home or after the umbilical cord stump falls off. They really don't put pressure on that area of their belly because babies are really head heavy, so they're heavier in the front. Having baby just on the ground parallel to the floor is too hard for a newborn. So you can start it with these other positions and you want to adjust gravity so they're not completely parallel to the floor. So on your chest is a way to do it. So in this top picture here, now she is completely flat on the ground. This is going to be way too hard for a newborn. This baby is obviously not a newborn. So if you are on the couch or in a recliner and then have baby on your chest, that's going to be easier for them. Then on a physio ball here is another way to do tummy time as well. And then I'll show you these other modifications on the next slide here. So here, this is my daughter around 4 4.5 months here. So another way you can do this early on, I did this with her as a newborn, is to elevate your foot right here on a yoga block and then have your hands underneath their elbows so their elbows are underneath their shoulders, your other hand on their bum or belly, and then you can adjust gravity so you can see she is tipped up a little bit so it's not as hard for her. My baby had some reflux, so this was really helpful because I felt like I would try to feed her and then do some tummy time before her next nap, but then she would just spit up a ton. So this was really helpful to get that strength and tummy time in. Same thing with this picture over here in standing. Again, I'm cradling her elbows close to my body so they're underneath her shoulders, and then my hand on her underneath her bum onto her belly, and she's doing some tummy time there. And then this video in the center is laying the stroller flat, and then baby can look around. You can also see my dog and husband here. She really loved this, going for a walk like that. All right. Little bit about bath time. So I read that, babies love bath time and whatnot, but Hazel hated baths until we started using swaddle blankets to keep her warm in the bath. So we would just kind of like gently drape it over her in warm water, and then she would really like that, and it would keep her warm. Also, early on, we put a towel in the dryer when we would get her out. And, she phased out of these things too. But when newborns' nervous systems are so immature, they're very, very sensitive to these different changes in stimuli like cold and hot. And everything's a new experience. So, those comforting kinds of things of warmth can be really helpful early on. All right. So showering can be really hard. Their wake windows are so short. So a baby bouncer was one of those things that I didn't realize would be as helpful as it really was. So, I would put her in the baby bouncer. I could watch her, and then she could, play with her toys during it. All right, so really shifting gears here to talk about doctor's appointments with babies and toddlers and just like continuing on through adolescence. We want to create positive associations and make these easier for you and for the child and the medical provider. So, I previously worked in peds and I worked with child life specialists. So I've picked up some techniques from them. And one of those is comfort positioning. So these are some examples of holding the child in a way that is comfortable to them. And if they're old enough to choose, then they get to choose how they want to be held. So chest to chest, which is not shown here. Some of it depends on the procedure, but a lot of these you can are interchangeable for the procedures. So chest to chest or back to chest as shown here. You definitely do not want to lay your child down and pin them down on their back. That is not recommended. There's no sense of control there. It creates really negative associations and it's very scary too. So comfort positioning is really important. You can also hold them on their sides, let them kind of choose how they want to be held with you. Think about the environment. So the lights. So when we've taken my baby for vaccines, I have them dim the lights so that they can still see, obviously, but fluorescents, are not warm and inviting. So think about that. Think about the sounds, like if they like a shusher, if they like to have music playing, kind of create a calming environment. Um, at the same time, you don't want these things to proceed or kind of like trigger that scary experience for them. So you want to base that on your baby's response too. You want to give some notice of going to the doctor and giving choices and opportunities for control when the baby and the child is old enough. So if they want to count to 3 until their poke happens, and we call it a poke, not a shot, not an injection. Poke is a little bit more friendly, but again, you can call this whatever you want to. Maybe your child gets to choose what they call it. And at home, engaging in medical play. So playing with gloves, playing with a toy stethoscope or a toy syringe. These can be helpful in creating some control familiarity too before going to the doctor. Let them give you pokes with their play syringe or take your temperature in on your forehead or your ear, those kinds of things, or your temperature in your mouth. So let them engage in that medical play. You really want to advocate for your child A lot of providers don't know about comforting position or have not worked with child life specialists, even in pediatric offices. So advocate for your child and what you know is best for them and to improve their ability to cope. What we know in the research is that coping is more related to the child's perception of the severity of the intervention versus the actual severity of the intervention. So we want to improve their perception via all the things we just talked about, and that will improve their ability to cope. Um, this can be used for injections, blood pressure, temperature, really any procedure that they have. You can take these techniques. And then some resources here. Emma Hubbard is a pediatric OT. She has a great YouTube channel. Irby and Babytime are tracking apps. If you have difficulty remembering when the last sleep was, like if you're tracking wake windows or feeding windows, it can be easy to go overboard on this. So know yourself, and if this stresses you out, if it's doing more harm than good, don't use it. But if it helps you kind of keep track, because those timeframes can go by quickly, then you can do that. Whenever you have questions, go to the American Academy of Pediatric Guidelines or ACOG, the American College of Gynecology Guidelines for Pregnancy. Those are the governing bodies based on research. That's where you want to get your information from, especially when there's a lot of misinformation out there. Our Limitless Life app, we have a lot of content and courses coming up similar to this. So be on the lookout for that. We're really trying to build up that community and empower all of those in the perinatal time. And then Caroline Packard is a physical therapist on Instagram. She has really good evidence-based fitness forward education on there. So that's a good place to go, knowing you're going to get good information for pregnancy and postpartum. And then lastly, the Institute of Clinical Excellence. They have a podcast on pregnancy or on pelvic PT. So that comes out. A lot of it is based toward PTs, but they also have Instagram with lots of really good evidence-based information for pregnancy and postpartum. So I would check out Institute of Clinical Excellence as well. All right, so I hope that this was helpful for you. If you have any questions on this or feel like you could benefit, pregnant, postpartum, anywhere in that journey, or even years afterward, please come see us at Limitless, and we are absolutely happy to work with you. Thank you so much.